Welcome back to our Health Mobile Apps series. LucidQuest analyzed 14 therapy areas in the first half of 2025 and provided rankings of top apps by downloads and by our proprietary LQ score. For full rankings and insights, download the complete report. Let's explore the highlights. Alzheimer's and dementia apps focus on gamified cognitive training like Lumosity and Neuronation. Most lack direct symptom tracking or caregiver support. Only 40% reference scientific evidence. Arthritis apps such as Manage My Pain support symptom logging, but few are built for rheumatology care. Users appreciate simplicity, though clinical depth is limited. Cardiovascular apps show maturity, with tools like OMRON Connect offering device syncing and blood pressure monitoring. CE-marked clinician apps are still rare, but emerging. Crohn's, colitis, and IBD apps focus on FODMAP diets and symptom tracking. Monash FODMAP stands out for evidence-based design, though many lean more toward wellness. Diabetes apps are highly developed. Libre LinkUp and Diabetes M enable real-time glucose tracking, often linked with FDA-cleared devices. Ratings and trust are consistently high. To see how these apps rank across usability, validation, and user sentiment, download the full LucidQuest report. Hemophilia apps like MyWAPS and HemActive focus on infusion and bleed tracking. Backed by pharma and nonprofits, they still see low download volumes and sparse reviews. Kidney health apps include FDA-cleared tools like Minuteful Kidney Test, but most serve niche audiences with limited UX polish or visibility. Depression apps like WISA and Healthy Minds emphasize CBT and emotional support. 80% of user sentiment is positive, though few apps claim to treat major depressive disorder directly. Migraine apps, led by Migraine Buddy, offer robust tracking and trigger logs. Some collaborate with research institutions, but validation remains limited. Multiple sclerosis apps such as My MS Manager and Shift MS blend tracking with community. BeCare MS Link is one of the few showing clinical integration. Oncology apps split between clinical tools like NCCN guidelines and AI-powered skin scanners like Skin Vision. Diagnostic accuracy varies, raising trust concerns. Parkinson's apps remain early stage. Tools like Steady Hands assess tremors, often backed by nonprofits. Most lack clinical validation and user feedback. Psoriasis apps rely on AI skin analysis, but rarely offer disease-specific features. Monetization models often reduce user trust. Respiratory apps like IQ Air and My Air by ResMed focus on air quality and CPAP adherence. Tools tailored for asthma and COPD are still underrepresented. In summary, personalization, usability, and AI are driving adoption. Yet physician integration, transparency, and clinical validation are still missing in many apps. To access complete rankings, validation data, and strategic insights, download the full LucidQuest report. Contact us at info@lqventures.com for expert insights. And don't forget to like, share, and subscribe for more updates on mHealth, digital health, and AI.